First we are going to see the embryology of heart. So this under this topic we are going to see how the heart has been formed and what are the structures are involving in it. So first, the basic embryonic sac is, which contains amniotic sac and yolk sac, so which is separated by a bilaminar disc. So this bilaminar disc has two cells, epiblast and hypoblast. So this bilaminar germ disc is converted into trilaminar germ disc, which contains ectoderm, mesoderm and endoderm. So all these layers form the trilaminar germ disc. So this transformation process is known as gastralization. So after these trilaminar germ disc formation, we have this ectoderm, mesoderm and endoderm. So this ectoderm forms the amniotic sac. Endoderm lines the yolk sac. So middle we have mesoderm. So embryology of heart. Heart is mainly formed from the mesoderm. So this mesoderm, upper layer is ectoderm, lower endoderm, middle is mesoderm. This mesoderm is again divided into lateral plate, intermediate and paraxial. And here we have notochord. The shaded dot is notochord. So these are the mesoderm parts. So from the lateral plate of mesoderm mainly involves in the formation of the heart. So here we have uh, going to see only the lateral plate of mesoderm. So this lateral plate of mesoderm consists of two layers. Somatopleuric layer, which is closest to the ectoderm, and splanchnopluric layer, which is closest to the endoderm. So and we have undivided part, which is known as septum transversum. And we have a cavity which is known as intraembryonic coelom. So these are the embryological structures which involves in the formation of the heart. So now we are going to see about the formation of the layers which surrounds the heart. So layers, first we have outer fibrous layer, inner serous layer. In serous layer we have parietal layer and visceral layer. So this fibrous layer is derived from septum transversum, or it developed from septum transversum. And visceral layer, or is also known as epicardium, which is developed from splanchnopluric layer of lateral plate. And parietal layer, which is developed from somatopleuric layer. And we have the pericardial cavity, so which is derived from the intraembryonic coelom. So as we know, in the embryonic stage we have one cavity which is known as intraembryonic coelom. So this cavity forms the pericardial cavity. So these are the layers, formation of layers of the heart. Now we are going to see about the layer of the heart, development of the heart. So we have a cardiac area. So this muscles of the heart are formed from, are referred as myocardium. So this myocardium is developed from splanchnopluric layer. So this splanchnopluric layer of lateral plate mesoderm is referred as cardiac area. So from in the cardiac area, initially we have heart tubes, two heart tubes. Again it going to fuse. In fusion, upper end of the heart tube or cranial end of the heart tube is fused completely. See, upper end which fuses completely, whereas in lower end we have it does not fuses. So the structure formed here is like this. The structure will be formed. The cranial end will be, after this formation, that some dilatations will be taking place to form like these. The structure will be like this. So these dilatations part are known as, see, right horn and left horn. First structure is sinus venosus, then primitive atrium, then primitive ventricle and bulbous cordis. So all these structures will be formed. So bulbous cordis contains proximal one third of bulbous cordis and conus and truncus arterioris. These are the segments in bulbous cordis. So we are going to see what are these structures are formed in these parts as a embryological development. So see, first right horn and sinus venosus form the smooth part of the right atrium, and absorption of pulmonary veins forms the smooth part of left atrium, and rough part of right atrium and left atrium, primitive atrium. So we can conclude that the atrium is formed from the primitive atrium and sinus venosus. So primitive atrium, which is involved in the formation of rough part of the right and left atrium. As you could see, these are the formation of right and left atrium, whereas coronary sinus is formed from the left horn of sinus venosus. So these are the formation of right and left atrium. So again I'll say right horn of sinus venosus and sinus venosus forms the smooth part of the right atrium, whereas smooth part of left atrium is formed from the absorption of the pulmonary veins. As we know that in the left atrium, pulmonary veins will be open. So this absorption of pulmonary veins forms the smooth part of the left atrium. Then left horn of sinus venosus forms the coronary sinus, and primitive atrium forms the rough part of right and left atrium. So by these way the right and left atrium are formed. Then we are going to see about the formation of ventricle. So rough part of ventricle is known as trabeculated part of ventricle. So this trabeculated part of left ventricle is formed from primitive ventricle, and trabeculated part of right ventricle is formed from proximal one third of bulbar quadris, and smooth part, whereas smooth part of both right ventricle and left ventricle is formed from conus part. The smooth part of right ventricle is referred as infundibulum and left ventricle is referred as vestibule. So infundibulum and vestibule is formed from the conus part. So infundibulum is the smooth part of right ventricle. So smooth part of right ventricle and left ventricle forms from the conus part of the bulbous cordis. Then truncus arterioris. This truncus arterioris gives the development for the pulmonary trunk and aorta. These are the two major vessels of the heart. So fossa ovalis and lumbus fossa ovalis. So fossa ovalis is presented, these two is presented in the septum of the right atrium. This is formed from the I'll say you during the septal formation, that then you could understand easily. So these are the formations from the parts of the heart tube. So these are the main things. These are the formations of the right atrium, left atrium and left ventricle and right ventricle are formed from the heart tube. So we know that the primitive atrium and sinus venosus forms the atrium. Primitive ventricle and bulbous cordis forms the ventricle. So, but whereas the ventricles and atrium is not divided as a right and left. So we have to see about the septum formation. Septum formation in this sense, the septum which is presented between two ventricle is interventricular septum, and atrial septum which is presented between the atrium. So first we are going to see about the septum formation. So neural crest cell. So as we know that, see, this is the, as I said, the shaded dot is known as notochord. So above that layer of ectoderm is referred as neuroectoderm. So this neuroectoderm is separated from the ectoderm to form a neural tube. So this neural after formation of neural tube, some of the cells from the ectoderm are splits out to form a neural crust cell. So that neural crust cell forms the spiral septum in the truncus arterioris. As we know, truncus arterioris give rise to pulmonary artery and aorta. So that two are separated by the spiral septum and the interventricular septum, which is formed by the three components such as neural crust cells form the bulbar septum in the conus part of the bulbar cordis. So muscular part, which is nothing but the muscles of the heart itself forms the septum, and the membranous part, endocardial cushion, which is presented in the AV, which is also known as AV cushion. So that forms the membranous part of the interventricular septum. So all these forms the septum between two ventricles. Now we can divide the ventricle into right and left ventricle. So in arterial septum, which is quite tricky. See, first in the layer of the heart, a primum septum primum arises. So from that, then next, this septum primum slowly move towards the endocardial cushion. So the gap between these two is known as foramen primum. So this foramen primum is normally enclosed, but at the same time, the primum septum on the upper part is degenerates to form foramen secundum. So as you know, foramen secundum is formed from the septum primum, not septum secundum. So foramen secundum is formed from the septum primum. As you know that the upper part of the septum primum degenerates to form foramen secundum. So after that, the septum secundum arises lateral right to the septum primum and forms the foramen ovale. So then after foramen ovale, after the birth, it encloses fully to form the atrial septum. These are the septum formation. Then we have to discuss about the congenital heart disease. Congenital heart disease is nothing but before the birth, some defect in the heart. So some of the defect, what are the defect maybe means, first spiral septum, which is formed in the truncus arterioris. So when this spiral septum is not formed, aorta and pulmonary trunk will be a same compartment. It will not be separated. So this leads to patent pulmonary trunk, patent truncus arterioris. This is the clinical condition. When the spiral septum is not formed, it leads to patent truncus arterioris. In the sense, truncus arterioris will be persistent. It will not be divided. The spiral septum is not formed. Then second clinical condition is the spiral septum is formed, but it is not spiral in structure. This leads to transposition of great vessels. In the sense, the position of the pulmonary trunk and aorta are not in a correct position. The position is changed. In the sense, pulmonary trunk will normally pulmonary trunk will be front, aorta will be at the back, but it is interchanged to which leads to transposition of great vessels. Okay, so third condition is spiral septum is formed, but it is displaced ventrally. In the sense, the septum should be at the center, but it is formed in the front of the truncus arterioris. So this pulmonary trunk is get reduced, aorta will be more spaced. So when it is more spaced, it is referred as overriding aorta. When the pulmonary trunk is reduced, which is referred as stenosis, pulmonary stenosis. So then right ventricle hypertrophy will be taking place when the pulmonary stenosis taking place, because pulmonary stenosis, the blood supply will be reduced. The right ventricle has to be pumped the blood into the pulmonary trunk or pulmonary artery. When that is not sufficient, it leads to hypertrophy. So overriding of aorta will leads to interventricular septal defect. So all these four are the tetralogy of Fallot, which is referred as tetralogy of Fallot. These are the four defects in it. These four defects is due to chiral septum is formed ventrally, more front in the truncus arteriosus. So these are the congenital heart disease.